All the 2026 Northern Cass School Board meeting to order. Start by reading the board norms. Actually, I'm going to start by welcoming Mike to the table. Thank you for serving.
Thank you.
All meetings will be conducted according to the best practices governing a Board of Education. All members will participate in board discussions in a respectful manner, which honors the different perspectives. All members will equally participate in making motions, seconding motions, and voting on each motion. All meetings will abide by the policies which govern the Northern Cass School District. And all members will follow the agenda to ensure discussion is focused on the agreed agenda items. All right. We would need a motion to approve the agenda as presented. Also move.
I'll second.
Roll call vote.
Bierke.
Aye.
Chalbert.
Aye.
Johnson.
Aye.
Lovejoy.
Aye.
Birch.
Yes.
Olson.
Aye.
Stefas.
Aye.
All right. Then we go to acknowledging greatness. We have the math club here with us today.
I'm Caitlin Whitner. This is my second year involved in math. This year as like the head advisor. Clinton Nicole Severance did an awesome job on like getting it up running, gosh, probably 12 years ago now. And so since their kiddos are gone now, I took it over. We have 8 individuals in math club this year. We also have 2 that aren't here today, 8th graders. So they're going to high school math competitions, competing against high school kids as 8th graders. So it's pretty cool. We have 5 meets throughout the year, and we go to Fergus Falls and compete against some Minnesota maths or Minnesota high school, excuse me. And in our section right now, we're 3rd out of 5. We've got 2 meets left. We're only 4 points behind first place. So it's kind of anybody's game right now with where we're at with standings. So I'll have the kids introduce themselves, and then Marshall's gonna talk about kind of what our math meets look like.
My name is Isaac. I'm a junior, and this is my first year in math club. And I joined because I wanted to challenge myself more.
I'm Tyler. I'm a senior. This is my first year in math club. And one thing that's been fun is getting to meet new people and see them at the competitions.
I'm Jace. I'm a junior. I've been in math club for about 2 years. And I joined because I've been pretty good at math.
My name is Aiden Dixon. I am a sophomore, and this is my 3rd year of math club. And one of the biggest reasons I joined is because it's a really nice extracurricular activity. You learn from it, and you get to socialize with some of the other kids there. So pretty fun.
My name is Noah. I'm a sophomore. This is my 2nd year doing math club. I just joined because I've always liked math my entire life, and I also am pretty good at it, so I figured why not? Might as well give it a shot.
My name is Marshall. I'm a junior, and this is my 3rd year in math club. I initially joined because I've always been pretty good at math, and I didn't have much going on in the winter, so I just thought I'd join.
Do you want to talk about kind of like what our meet days look like?
Yes, so 5 meets in a season, and we always go to Fergus Falls. I mean, at the end of the year, we have Valley City. But in the winter, we go to Fergus Falls, and everybody has 3 tests: the A test, B test, and the C test. And the A test is just mostly algebra. B test is geometry, and then the C test is like a mix of general math, logic. And then we have the team test after too, which we all get to take part in.
Do group problem solve on the team test?
Yes.
Okay.
Yeah. That's normally we like section it off. So like I'll go for question 3 and 4 or whatever. With Aiden and Aiden will join me, and then like Isaac and Jace will do 1 and 2 or something.
Okay.
John and Marshall 5 and 6.
Okay.
Well, the tests are only 5 questions.
Oh, okay.
You might think like, oh, 5 questions. And typically like your average score on those tests are like 3 points is good.
How
If you get
long
3 out
do
of
each problem or the test take?
We get 15 minutes.
Okay.
You guys say you usually use the whole 15 minutes to work on it?
Yeah, with question 4 and 5 being as hard as they are, yeah.
Any other question? We should have brought some questions for you guys.
How many? At,
So in our division, there's 7 schools there, but only 2 of the schools in our section are there. So there's anywhere from, gosh, sometimes there's 100 kids that show up, 100 kids taking a math test at the same time. And we tally up us coaches have to quick grade them and get them in the grade book. And then we see kind of where we're at right away during those meets.
What's the hardest problem you've had? What type of problem?
Probably on the team tests like last year, those are usually really tricky. So it takes like a lot of work and like really like specific like kind of like equations to like solve them. So
It can be in several different things. Some of them I don't even know because I haven't experienced enough math, but some of them are advanced, like trigonometry sometimes. and
That's, yeah, what I was
Yeah.
curious about.
Some of them
Throw
are-
things in that you might not know and see if you can.
Mhm. Yeah, not many people know those. So on the team test, it's not uncommon to get only like first 3 or something.
Okay.
do you guys have certain individuals that are better at certain aspects of math or certain areas of the math and everything?
Yeah.
And try to put those people into the areas that they excel at?
Good questions.
Good job.
They figure it first.
The practice after school, where do you guys have a date?
There you go.
They're counting numbers for you now, or?
Taking the math club with them. Yeah. Right? Perfect. Can we put it on solid?
Is there anyone else that would like to have public comment? All right. Moving into the consent agenda, please.
So right now with our general fund, we're sitting at $2,338,602.55. Our activity fund is sitting at $445,403.62. Hot lunch program is at $228,710.91. Heating and electric for the month of December was $15,574, which of electric was $4,856.48. And for the interest for the month of June here, we had collected $573.91. December.
All right, is there any questions involving anything on the consent agenda? Okay, we would need a motion to approve the consent agenda.
Also moved to approve.
I'll second.
Any further discussion? Roll call vote, please.
Beerkey.
Aye.
Gilbert.
Aye.
Johnson.
Aye.
Lovejoy.
Aye.
Birch.
Yes.
Olson.
Aye.
Stefas.
Aye.
Right, I think we'll move into board education now. We have some representatives from Essentia Health here with us. I'll allow them to do their own introductions because they'll do it better than I will.
We're from the math club.
I'll bet.
I'm Kerry Carlson. I'm one of our vice president of operations at Essentia Park.
I'm Zach Lynn, operations director, Essentia Health in Fargo. So thank you all for the opportunity to come chat with you this evening. We have a folder. I'll hand one to each of you and pick up kind of our presentation.
Yeah, sorry, we were kind of prepared to do a PowerPoint, but we weren't really sure if we could bring a jump drive or how that works. So we did it the old school and got the appropriate.
A little more tactile.
I think this discussion has probably been had a few times.
Thank you.
So I hope none of this is new, but I just wanted to recap kind of what our proposal is in terms of the collaborative agreement with the system here in Northern Cass.
Thank you.
you'll see in your, this is kind of this PowerPoint, we've kind of put together a little bit of overview for each one of you. And then a fresh copy of the contract as well. So without going through the legal jargon of the contract, we thought we'd highlight what's kind of the key components of that. So at its heart, the contract is really a collaborative approach between Essentia Health or CAS, looking at a $250,000 cash contribution for an exclusive health and wellness, as well as a sports medicine contract with the school district. That would carry us over a 10-year period. I do understand there were some questions about, does it have to be a 10-year period and what's kind of the out in that contract? The contract can be canceled at any time without cause with the 60 days. So at any time you say this isn't working, we really don't continue this contract, you simply just say, we want out and send us a little note, and it ends in 60 days after. Now, what happens with the 250? That cash contribution is made over that 10-year period. So if you ended at 5 years, now here's my math club problem. We would stop making payments at that time. Nothing would be returned up until that point. There's no payback or anything like that. So very simplistic. We also make sure that we have an additional contribution that we're going to set aside into an account of $100,000, and that money is set aside for joint decision-making between our marketing team and the school board and the school district to say, we have an event coming up for all the kids, for all the parents in the community. We want to make sure we talk about promotion, materials, etc., signage, whatever happens in terms of that marketing plan. So we'll draw money from that. So no monies will ever come out of the 250,000 for any kind of substantive marketing activities or signage. Additionally, we have a sports medicine service contract, and I'm going to let Zach talk a little bit.
Yeah, thank you. So our sports medicine aspect here is the provision of a FT athletic training. All the school sporting events, that's at no additional cost to the school district for the duration of the 10-year contract. And that's including that training room coverage, of course, opportunities to streamline connections to care. And I can talk a little bit about some opportunities we've done. Some of the schools we contract with now, game coverage, of course, an advocate for your student athletes. And I know right now we're looking for a 1.0 and actually have a solid candidate. Well, and it came into my email this afternoon that we're looking forward to interviewing for. And so hopefully we can get that individual signed. And in the meantime, I know Bryce and our sports medicine manager have been really in good contact to really try to get the coverage right now. So, yeah, lots of good opportunities to have that athletic trainer teamed up with your student athletes.
Now, I own this room and I hope it's okay to share with you. Athletes are obviously important. We want to make sure we're providing great prevention, injury prevention work for all of them, but they're not the body of the school district. So we want to make sure we're spending time with every student and every faculty member. So it is the kids that are in DECA, the kids that are in math club that might not be in basketball. It's everything. And really what our intent is through this collaboration is we inject a lot of time and effort, education, to bring in additional resources to talk about overall health and wellness. So we don't decide what those topics are. We sit down with the school districts every year and kind of do like a SWOT analysis. We do some brainstorming. We talk about what is really important for the student body here at the school. And each year, sometimes it's a little different. It might be a lot of behavioral health issues that students are dealing with, and sometimes even the faculty are dealing with. They don't know how to respond to the situation. So we bring in our behavioral health specialists. We do educational seminars, things like that. For the kids, sometimes we got a big rash of kids vaping. well, we have programs where we come in and we say, let's help you with that. No, those aren't jump drives. Those are actually babies. Still remember that conversation at West Fargo. They were like, no, our kids just have a lot of jump drives. Yeah. But we also come into the schools and another one, you know, we really want our kids to be more well prepared. And I did this kind of personally. I said, you know, I'm getting older, a lot more gray now these days. And so I'm at risk, right? So I figured, well, we should probably teach every fifth grader how to do hands-only CPR. And also know the signs and symptoms of stroke, STEMI, heart attacks, right? Because they can save lives. And if we put them out in the communities and we educate on them. So every year at like West Fargo School District, all of the collaborative relationships we train thousands every year, kids in their gym classes on all this work. The great thing was that actually just this year, that was only a few months ago, actually, one of our students was at home with their parents, and I believe it was dad. They were noticing dad was talking funny, was having some difficulties. And I told the mom right away, and that he had to do something. They got him to the hospital. Yep, he was having a stroke, and saved his life. So it does make a difference. So those are just like three small examples. Yeah, laundry lists of different programs we do. Some schools we even support the nursing program. We also support career development. So we look at taking kids. At some of the school districts, we've actually put in pharmacy tech training where the kids are graduating. One school, I think we had 8, 9 students that graduate, got their diploma at graduation day. They also were all got a certificate as a pharmacy technician. They're able to walk into the job immediately after. We're looking at how do we keep connecting those dots, helping kids get into different health fields. You know, love, in addition to that, we also have some job shadowing that we also do, and then apprenticeship. So in the end of the day, really what we also want to take a look at is how do we provide more access for kids and faculty to get their health care. We know this is a rural situation, and we don't have a lot of healthcare. We don't have clinics out here. We don't have hospitals out in this area. And quite frankly, it's a long drive. And it's tough. It's tough on kids. It's tough on parents. So if all of a sudden, you know, Johnny has an appointment at 1 o'clock in the afternoon, probably in Fargo. Well, mom and dad has to take the afternoon. They got to take them out of school, and you got to take your child all the way to Fargo, get to their appointment. By the time the appointment's done, if you're driving back, school's over. You miss 3 classes minimum, maybe 4. Parents missed a half day of work. And if it's a repeated appointment, like a behavioral health appointment that occurs every other week, that becomes pretty arduous on individuals. So what we're looking at is how do we provide healthcare services here, either through a virtual platform, and then as we grow into this, we'd like to actually look at providing health services locally. So one of our schools right now, we provide some therapy services on site. We have a virtual access clinic on site, and now we have the nurse on site as well. So providing services right in the space. We're also investigating now, how do we look at space within the schools and their adjacencies to actually bring in like a nurse practitioner that can also be on site to provide health services locally. So anything I missed?
Well, I do want to just highlight like kind of the health science career pathway is something something that we love to work on with you as well, and you know, donation of equipment, that's what we're recognizing opportunities to provide some of those items, and then just really highlighting, I think the last bullet point there is that future innovative opportunities to deliver care folks though. And that's in collaboration with you all. Your community is hearing from you, right? What opportunities there are. And that's in an intentional meeting frequency, so that we're not overlooking opportunities that you guys are seeing.
Yeah, and the healthcare delivery system, it's kind of up to us how we want to design it, and build it together. Whether, and it's not just for the students, that component is meant to be for the community. And really, how are we going to serve everyone in this area better? We truly do believe that, delivering healthcare close to home is the right way. We don't build giant clinics that we expect everyone to come to us. We've spent a lot of our strategies, our time and money over the last 10 years building clinics all over the countryside. And we're trying to bring it back to, well, honestly, what I was used to as a kid was having a local doctor in Camden, North Dakota. Then I walked down the street and saw Dr. Hiltz and took care of my sports physical and everything else I needed. So that's kind of the way it should be. We at Essentia at least believe that we're really good at rural health. And we want to make sure we're partnering with our rural partners to do that.
I just highlight to our accountable care and of course quality.
Yeah.
So we're accountable care, organization, and basically what that means is it really puts a lot of focus on quality, which is one of our values at Essentia Health. But we do better. Essentially, we deliver a higher quality, which reduces the healthcare needs of a community, and that's really what we want to help focus on is how do we focus on a lot of those preventative efforts, improve the access to care when it's needed. So we can take care of the need and it's there, but how do we overall just really focus on preventative opportunities?
Most health systems, the way they function and have for decades, it's called a fee for service. So healthcare systems get paid every time you come in and punch your name in and see the provider and get charged. It goes to your insurance company, and that's how they made money to be able to keep their doors open. We are one of the only health systems in the state that is an accountable care organization. And what that means, just to be that transparent, is we don't get paid 100% of fee for service. What we do is we take a large percentage of that money that we're supposed to get paid, and it goes on the table with the insurance as a partnership. And we say, if we provide better care and lower utilization of health services, they pay us for lower utilization, which is the right benefit. Because the less people that come to the emergency room, the less people that have heart attacks, we actually do better. So our job is actually to figure out how to make sure our communities are whole and don't use health services. Which finally, it starts making sense, doesn't it? It's been like, wow, that took 50 years for something to figure out. But it is the right way. So that's why we're so passionate about getting in front of every fifth grader to talk to them about eating right. Don't smoke, get exercise, know the risk signs, know your body, know your health. Because we actually believe we can make a healthier community if we do this right. But we need your to do that. We can't do that alone. Anything in the contract, any questions that you have that we'll touch on?
Sure, I'll go.
Okay.
I just quickly kind of skimmed through the contract here, but do you have anything like document prepared or something that you use with other schools? I know that in the past there have been like disagreements between athletic trainer, doctors. As far as laid out to delineate like how that works.
Come to that solution.
Yeah, so it's come up a number of times here in the past, and then it always kind of creates a little bit of a
friction.
Yeah, so I didn't know if you guys had. Do you do that with other schools or?
Typically don't put that in the contract. Ideally, our athletic training team comes together with the school and makes sure that our policies align correctly. And typically it is the athletic trainer who will kind of negotiate that return to play. Now, ideally, the athletic trainer is also in very close communication with the provider to ensure that the timing lines up. But yeah, usually it's not in the contract necessarily. That should be probably more in line with school policy. And
One thing we did at Essentia, and it's kind of in lieu of what you're saying. Our athletic trainers used to be kind of over in this department, kind of unto themselves. And the orthopedic surgeons, which is usually the doctor, right, that's handling a lot of these injuries, was separate. We put them all together. So they all work very closely. The athletic trainers, the orthopedic surgeons, the medical ortho doctors as well are all working in collaboration. And so they actually have a better understanding of roles, responsibilities, and how they work through the decision-making of the patients. Ultimately, if it's a surgical patient, our surgeon's going to make the decision about, no, I'm not allowing you to go back on the field after I just put 10 hours into your new ACL repair. So we try to let them make those decisions. But you're right, the trainer being on the field, being firsthand, they have first eyes on the patient. So they do respect their judgment. Now, I can speak if they go to another organization, then yeah, they may have some negotiating to do.
Any other questions?
I sure appreciate your time. Thank you so much.
Thank you.
Right, moving into administrative reports, please.
I can go. So easy school pay for the month, we have $10,274 on 26 transactions. For the year, for transportation, we have brought in $26,300 thus far. A grant update, congratulations to Shallon. She applied for a North Dakota Count Screening and Intervention Pilot for the 26-27 school year for math, and she received $11,023.90 for the school, and so we're looking forward to that intervention pilot coming across. Committee meetings, we had buildings and ground, we had nothing at this time, but budget and human resources, nothing at this time. And then when we get to teaching and learning, we do have a first reading policy to do. Tom Iverson update. We met over holiday break, and our conversation was empowering people through autonomy. And I actually think it's shown through a little bit this morning in our PLC administration PLC, when we started talking about some of the surveys that we have given to our educators and the feedback that we received. And we started organizing and putting together a plan for next school year on what we would like to do. So it was a great conversation with Mr. Iverson, and then it led to a great conversation this morning in our PLC. And then another piece that Mr. Iverson and I talked about was restructuring some of the meetings that I have throughout the day to make them more efficient. And instead of what are you doing this week? What are you doing next week? Lean into it a little bit more. I meet with them again on Wednesday. And then I will be heading out to the North Dakota Association of Superintendents out in Bismarck, January 25th and through the 27th. And Doug and Mackenzie are going to be presenting out there on some of the things that we do here at Northern Cass to the superintendent group from the multiple schools. They will be doing that Monday morning. They have 2 presentations they'll be doing out there. And then we have the preschool parent presentation on Wednesday, January 14th at 6 o'clock. And Krista and I will be showcasing that. And then the best of class, I keep looking for that for the 26-27 school year. And that as of this morning, I didn't look this afternoon, but as of this morning, it had not opened up yet.
Thanks, Terry. We would like to, yes, Krista, you're
Sure.
the only other.
I sent Mr. Merger home this morning. He wasn't feeling well and I wasn't here last week, of the week, so I apologize. Under general information, it says elementary preschool enrollment and it still has December's date. But it is accurate, but it's for January as well. We're still at 357 in my pre-K through fifth grade. So I caught that as I was sitting here. I'm like, whew, welcome back, Mrs. S. So my shout outs today, educators in the elementary, we have just had a really, I'm probably gonna jinx it right now, but we've had a very smooth transition back from Christmas break. I was really nervous and I think a lot of people were with a solid 2 weeks off. And then coming back to a solid full week of school. Sometimes it's like a Thursday, Friday, and then, it's just ease in, but the kids have just been up to the challenge and so have the educators. I think it helps. We've been able to get outside. It's not like solid indoor recesses. That of course creates more of a challenge because we don't always have space for indoor recess. So afternoons, that's when middle school, high school are having their PE classes. So my elementary sometimes struggle to find space, but we're making it work and it's been great. My other shout out, I'd be remiss if I didn't bring it up, is Miss Haugen. Her first ever holiday concert was this December, and it feels like eons ago that we just had holiday concerts, but she did a great job for her first ever, and she did that was the first, second grade concert, third, fourth grade concert. And then the next morning we said, let's do it again with our pre-K and K and Grandparents' Day as well. So there was a lot going on in those 24 hours. She was exhausted, but very pleased with how it went and said her biggest comment to me was the people here are so appreciative and just really gracious. And she got a lot of great comments. So she was very pleased and had her family there too. And they were pleased. So it's kind of fun to see. What's new? This week is our benchmark testing week. So obviously in February, I'll be able to give you some data and that Mr. Marjoram will as well, because we'll have middle school, high school also doing some benchmark testing. Like Mr. Basler brought up, was the best in class school informational meeting is Wednesday. And I think one of the things I talked with the preschool teachers the other day that we talked about was, how critical it is to have that funding come in. And so waiting for that grant, but also what are things that we can do in the meantime if we value preschool in our school? And currently the state doesn't fund preschool. You have to apply for a grant or whatever. And these rural districts, I just looked it up today because I talked to Courtney and Jackie and I said, well, we can write our legislators and say, hey, if it is so valuable in the first 5 years of life are some of the most impactful, they're like little sponges then. And some of our kids have never had exposure to. So when they come into kindergarten, there's nothing. And I'm not saying all academics in preschool, there's that play-based learning, but what can we do to make more awareness around and just, really also promote the importance of? So that's something we're going to look at. And then Mr. Basler mentioned feedback because I'd shared at our January staff meeting for elementary, I gave a start, stop, continue sheet and everyone had to fill it out independently. And then I've culminated all that data and I've summarized a little bit. And then I had ChatGPT help me a little bit more. Like, was I picking out the right things? And so from that, I think we're getting like a top 5 of what are the top 5 things that we really need to maybe make changes on or continue doing, whatever that might be. But then the staff, we talk a lot about culture and being seen and heard. They see that we're trying to make those changes, or if there are things that we can do, it might be a quick win. We could even start this year. So just some of those pieces are in there. And I know Mr. Marjoram, I shared it with him and he said his January meeting was full, but he was going to try to do that in February. And then also that other survey we give, the Vital Network one, we'll do here end of January as well. And we'll have data for you in February. Questions? Awesome. Thank you.
And I guess we are just up to reading the others. They mentioned Doug went home sick today. And I assume Kyle is, or Mr. Laxdal is at basketball. So yes, we can move into teaching and learning then. So is there any other questions around the admin reports?
I suggest you guys read Tessa's report. She's at practice right now, so that's another one to read too.
Right. Turn it over to Ms. Fontana.
I was hoping to project, but I cannot project the computer.
Do you want to use mine?
You're good.
You could share it with me too if you need.
It's fine. I can probably turn it. So just kind of an update. So when I first started, I was tasked with our secondary MTSS lead. Right now, currently, I'm the only MTSS member, but that has changed.
You say what MTSS stands for?
Oh, multi-tier systems of support. So what we are going to be doing is I did survey our staff, and I had some interests that are very eager, trying to make sure that we're picking both middle school and high school educators representing each of the content areas. So that's our next step of what we're formulating. But I did create a process of what are we going to do now until we create our long-term process. So right now we are currently have been dived in for several weeks into our short-term solution. And then what I have done is I created my goal is to create a handbook. What is going to be our way to, no matter who's in the building, if we have a new staff member, if we have a new team member to the MTSS team, what can we pick up and say, I know how to walk through this process because the team has laid it out. So that's kind of the goal. I've mapped out about 12 action items that once our team comes together, what we're going to be creating and working on for the next probably at least year and a half. Now that means we're building on it. That doesn't mean we're just gonna hold off until a year and a half to get started. We're already started. So one of the processes that I've done is I have created a schedule for the entire school year for every weekly meeting. So I meet with all high school, not all high school, but we meet on students in high school every week. We meet on middle school students every week. And these conversations aren't to be, how do we just talk about what's going wrong and then kind of all share that experience and then walk away with nothing. What the educators have to do is we go through a full system where the first step we do is we talk about the learner's strengths. So that way, hopefully we can maybe find something within what they do well and really grow that. We talk about if they're connected to somebody or something within our school. So whether they're connected to some sort of activity or person in the building, if we have that as a no, that's a strong indicator for us that that's our next step is we need to build connection with them. So if they see value in the place they're coming to every day. But then this is just kind of a dashboard. What you'll see here is every student that we talk about. Oh, my computer is about to die. Every student we talk about is tracked. And with the important pieces, when they walk away, the team is deciding what strategies do we want to implement over the next 6 weeks that we are all on board consistently doing. And after that, I then go in and create a SMART goal that's trackable. And we either use performance grading, we either use their missing work list. Otherwise, I'm creating a data tracker that they will go input how this learner's doing on that goal so that we can measure whether it's working or not. It is not uncommon to come back to a meeting and go, oh, that I didn't understand that strategy as well, or I just really found a barrier in time to do that as consistent, where we say that it wasn't done with fidelity. But then that's that conversation of what made it challenging for you to do that. Is this then the right strategy? How do we improve it? And teachers have had a really, listening to them talk and collaborate has been pretty great because they're sharing ideas. We're talking about students at a high level, but then we're not just making decisions to make decisions. They're using this data tracker or their data process to say whether it's successful or not. So that's just currently what we're doing. We'll still, in the long term, have a way to track what we're doing, but right now we don't have strong interventions. So if we have a student who's struggling in math, there isn't anybody else right now that's teaching a math intervention other than a special ed teacher, which you have to have special ed, an IEP, they have to qualify for that. So we have to figure out what's our system. So a math grant opportunity came in to do a pilot. So right away, I talked to Doug and he's like, let's do it. So I wrote the grant in a very short amount of time. We got it. So it's going to take us through the rest of this school year, next school year. And I collaborated with our middle school educators for them to choose what they felt was going to be the program that they could do with fidelity. And they picked one that not only can be done in the classroom, it could be done. So we have different levels of tiers. Tier 1 is everybody's getting it. Tier 2 is who needs a little bit more, because what I have is just not quite yet enough for them. And tier 3 is how do we bring in some really heavy supports? So this program that we are piloting will have options for all 3 different levels that can be done by classroom educators, specialists, and it's a plug and play. So it's not, the biggest thing I heard from them is I don't want another thing that is another thing I have to plan for and take a lot of extra time and effort. They're not going to have to do that with this program. But another add-on to that is the state's requirement to have this grant is we have to now do the interim assessments for the state assessment, which I think is a bonus. It gives us more information on how they're doing, and it's a predictor for how they'll do on the state assessment in the spring. So we'll be working with DPI this week to get that set up. So we'll be doing that in addition to our AIMS and STAR benchmarking. I gave you a lot of information. What questions do you have for me about maybe the process? Anything that you kind of pondering?
Sounds to me like you're doing a great job.
That happens up here. That doesn't always make sense when it comes out when you hear the whole system, but lots been working. So, okay.
Thank you.
Thank you.
Yeah,
For
thank you
your
for your time.
hard work.
All right, I think Terry mentioned the committee, or does someone from each committee want to give an update, or there wasn't? Up to you guys, I guess.
On buildings and ground, I guess we did a lot.
There.
Oh, any right there. Mine there.
Don't look at me.
We got a couple buses that, I think Nathan had brought up at both High Miles, that search.
To look at, yeah.
Yeah. They were, anything else? We kind of went over just kind of some budget numbers mostly.
Yeah, and then just kind of reviewed some of the hires and.
Yeah, some of the hires and stuff like that. We didn't have a whole lot, obviously, like little things like the roof, we gotta figure out where we're gonna go forward on that. The floor, no tape. Continue no tape. Things like that, but it was pretty quick one. We didn't have a lot on the plate there.
Teaching and learning.
There wasn't much there either. North Dakota School Board Association still has all our policy stuff. We haven't gotten that back yet, so hopefully in February. And then employee board members, the BAA approved first reading. And then we discussed option 1 and 2. There was 1 we were going with, wasn't
No,
it?
2.
2,
Yeah,
okay.
yeah.
Oh, yeah, 2 is the best
Yeah,
option.
because 1 was
Absolutely
no sitting
nothing.
board member could be employed, which, you know, I keep bringing up the busing thing. And we couldn't even have somebody drive a field trip. So option 2 is that somebody on the school board could, with limited
coaching.
expectations and coaching, yeah.
Well, technically, we're all employees of the school district who get paid for even being at a board meeting. Technically employee, right?
Your stipend.
Yeah, but their tax is taken away.
But option 2 is the
Way to go.
is the way to go.
That's about it.
Budget and human resources, we went through the budget pretty well. On that, I don't think there was a lot of discussion, was there, Sean?
No. No.
Right,
Question on the activities committee, I know Mosier was on that. Do we have a plan for filling that position, or?
I don't think it's been discussed at this point, so I guess that'd be something if we want to discuss now.
We put that on the discussion maybe for next month then.
For February.
Yep. All right.
The page in charge of that.
So the only item would be then to have a first reading of policy BAA. Please, appointing board members.
I'll make a motion to approve first reading of BAA. Employee board members.
I'll second.
Any further discussion?
There are 2 readings or 3 readings needed?
2. Right, further discussion? Roll call vote, please.
Gerke.
Aye.
Gilbert.
Aye.
Johnson.
Aye.
Lovejoy.
Aye.
Merch.
Aye.
Olson.
I'm
Stefas.
Aye.
Small unfinished business. So then we'd be continuing. First item would be the second reading of the 26-27 calendar. Any further discussion about calendar? Done. Roll call vote, please.
We need a motion.
Oh, yes, sorry.
We need a first and second, please.
I'll move to approve.
Also, go ahead.
I'll second.
Now I should call for discussion. I got ahead of myself.
That's okay.
There's nothing that was changed from the first time, was there?
No.
No change.
Okay.
All right, now.
All right. Gerke. Gilbert.
Aye.
Johnson.
Aye.
Lovejoy.
Aye.
Merch.
Yes.
Olson.
Aye.
Stefas.
Aye.
Next item would be discussion around applying for the spring cohort of the Student First Governance Training through the NDSBA. I think we discussed it in all the committee meetings, as far as I know. Does anyone have any questions for Terry about it?
Well, I wasn't at our committee meeting, so, what, I guess what are the pros that?
So for me, what challenges presented would be a pro too. We would talk about some of the programs that we're going to implement to improve student academics and with the school board. So we wouldn't get questions. You know, I've had a few questions like what exactly is personalized learning, or what is it exactly is high reliability schools, and how does it pertain to improving student knowledge? And the student first collaboration, this governance would allow the school board to, let's take a look at this data and how is it improving? Is it improving? Is it working? Is our personalized learning working? Are the studios working? HRS, do we really have effective teaching in every classroom? And how is this, how is it showing in the student data? So it would kind of turn our attention a little bit more to improving student knowledge and becoming more aware of what we're doing in the school and what it's going to look like or should look like to improve student knowledge. And then is it working? I had a conversation with Rob Leck and their school board meeting. I didn't bring it up here, but he has it all laid out where they take a look at each performance standard and each matrix they're looking at the beginning of each school board. And then, yes, this is, we're working on this. Is it showing improvement? Yes or no? And then how far out is it yet until we should start seeing improvement? So it just kind of guides the conversation a little bit more about academic achievement.
How does it quantify that? Like, how do they, are they doing this? Are they calculating that, or are they taking that information and plugging it in? How is that?
So with Jamestown or with Jamestown, it's written into their strategic plan, and we had talked about it where, I wouldn't write a strategic plan based on student governance, but I would write student governance into the strategic plan. Right now they're using a lot of surveys, which is what we have been doing around the school here, using a lot of surveys to try to, where do we need to go? Aligning curriculum, was one of the things that that we talked about this morning that the staff really wants to get into. So right now Jamestown is just using a lot of surveys and then using like the Ames web testing is coming up and using some of that data to show, okay, here's where our students are, here's where they improved from last year or didn't improve. And then we can start asking the questions. I use the middle school ELA a fair amount of time as a example. It's, we're below state average in middle school the last 2 years. Why? Are the things that we have in place working? And I think it's important for as a board to understand the programs that we have in place. Not that we can't talk about them, but understand the programs that we have in place. MTSS, 6 months down the road, how is that working and how does that look? Are we getting those kids caught up and closing the gap a little bit more? Conversations like that drives the student first governance.
So are we using them or this program to aggregate that information and
the program, they're going to provide guidance. They're going to provide coaches to us on how to start implementing that kind of procedure for our school board meetings.
So they're consulting basically.
Yes.
Okay.
Yeah.
But they're taking the information that we're giving them.
Yeah, and not even that they're going to look at our information. Here's the information we have, and then they're going to tell us how best to incorporate it or have those conversations. There's a lot of initiatives that have taken place at Northern Cass over the years. Now, try to figure out what's working, what's not working. Is student data showing that? And it's not necessarily we're not going to give the state assessment every month. It can be different measurements like that. MTSS, is it working for Shallon's group of kids that they're, are they improving? Are we seeing growth? Are we seeing improvement? So that's the big piece that student first governance is just getting a lot of the focus around student improvement. And with student first government, their thing is that the board, if the board sets the example, holds me accountable for improving student performance, which in turn I hold principals accountable and educator accountable, and hopefully we start seeing growth. Hopefully we make a difference with the middle school ELA and start improving some of that stuff.
So, and this is a new program, it's just starting up.
Yeah, so it used to be Be Legendary. But Be Legendary was ran by people from Texas or put together by people in Texas. This student first governance is put together by people in North Dakota, North Dakota School Boards Association. And what the legislation did is they set aside $25,000 per year per school that joins this. And then it costs the school district $5,000 a year just for 2 years for the counseling, for the consultant and the coach to drive this. North Dakota's goal is to get all 168 schools. It's each school's choice. It's not the state that's going to drive that. But I like the piece. I think it gives really solid direction on student growth. And that's kind of what we're here for, is that student growth piece.
But it's just taking our initiatives, what we're doing, and kind of summary.
Yeah, it's not going to change any of our initiatives.
It's not bringing something
at all.
And it's just like our discipline matrix or our things like that bring it to our attention more.
Yes.
For the school board.
Yeah, it's going to be our stuff. Okay. Yes. Yeah. Like even that Shallon's MTSS piece, that's our stuff, and her stuff. And we did not have the MTSS process in the high school. So she is just introducing this, and it's rolling in the elementary. It's been in the elementary for a long time, but middle school just kind of, Sam started it a couple of years ago now, but it's our stuff. And then is our stuff working? Are we seeing the growth that we want to see?
Are they doing anything that we can't do ourselves?
I think a lot of the guidance and the governance and the piece and a little bit more of, here's what school board meetings should look like, and here's what, could possibly be discussed. It's supposed to build a cohesiveness between school board, administration, educators, and students. And can we do it ourselves? Not sure.
Well, I'll be honest with you, when we had that presentation, I felt like it was a sales pitch. I found myself asking when she was talking about this, well, we already do that. Well, we already do that. We've always been at the kind of the forefront of a lot of this stuff around the state. And I personally felt like we already do a lot of that stuff. So why are we gonna spend $10,000 on something that we've basically been leading other schools up until this point? So I just felt like we're gonna pay $10,000 for basically a certificate saying we're that's what I got. That's what I took away from it, Terry. I'll be honest with you.
Yeah. Like I was able to sit through that meeting too, and that's kind of, and I brought it up during the committee meeting.
Yeah.
Not trying to be disrespectful to anybody at all, but it just seemed like at the end, we're gonna pay $10,000 over 2 years to be consulted on what we're already doing. And presumably get some direction on how to do what we do a little better or a little smoother or a little everything. And I mean, that's awesome. That's great to have that. And I think there's probably some things that some resources that they may have that we could definitely use. It's just whether it's fiscally responsible and whether we're getting the best bang for the buck out of it is my big concern. So
I guess personally, to follow up on what Mike said, so there's a spring and is it twice a year that you can?
Yeah.
I personally would like to, if it were me, I would like to discuss it with some other schools who join up and enter the program right away and just see what's your thought. Has it been worth are you getting anything out of it?
Sure.
I'm not real anxious about just spending $10,000 on a brand new program that we can't get some firsthand feedback from other schools.
Sure. Is there
just me?
Yeah, sorry, I didn't mean to.
No, you're good.
Is there a time frame on when we have to make a decision on this? Or?
Well, this for the spring cohort, yeah, it's this meeting, but like Brad said, there's a fall cohort as well.
I mean, are they willing to work with us if we send somebody to it before we make a decision? Or like I
haven't asked that question.
Yeah, I mean it's
yeah.
I just didn't. I felt like I got a lot of fluff and I didn't get a lot of information. That was kind of where I left that when I left that meeting. So.
Right, I think the deadline for this cohort is January 31st. So this meeting is where we decide for this round. We can try again in the fall if we want to get more information. The other thing that has come to my mind is we may have some turnover on the board in June, because now the time to start, we're going to have new board members coming on. Is it better to start when we're starting with a full slate? That would be one other thing that I would bring up.
Okay, I didn't know if I should talk or not. Currently, what we have to say if something's working or not working, remember like a couple of years ago, we made that one web page that kind of has like our, what's it called? Scorecards. And I'm not sure that that's super clear to everyone when you just look at it. Does it tell you if we're being successful or not successful? So I think one of the things we're also talking about is what would help us delve in even further, because it's not always test scores, right? We also have a spot in there when we go in and do a walkthrough. Well, when I do little 10-minute walkthroughs here and there in rooms, that still doesn't tell me like, is it effective teaching in every, there's so many different pieces. So I think that's something to consider too. When we talk about personalized learning, have we gone too far one way in the personalized learning versus, shifting back to the middle? Is there a better way to do things? So I think that's too something that we all wonder. You're trying to make the best decision and you believe like you're impacting kids, and that's why we're in the profession and why we're all doing what we're doing or sitting at this table. But yeah, what is the best, but also what is fiscally responsible? There's all those pieces that come into play. That's kind of the conversations we've had is, even getting the start, stop, continue from an educator's viewpoint, what's going well and what's not, or what should we work on? But then also, are these programs that we are using, are they really making that difference? That's where we're trying to balance it all. Where I just wanted to give, like, currently that's all we have to show is that right now, which we're inputting a lot of the data ourselves. So just
share like transparency. They said the fall cohort would be in August or September in-person training.
Who has to be at that, all board members?
They want 70% attendance. I think it's Todd, Chris, and Sean. It might not work. Or work months. Oh, he should.
I mean, overall, I think it might be a good thing. That's the one lingering question I have is now the time where do we want more information? Do we want to see where we are in the fall?
Is this the first cohort, the one that you would start now? So there isn't even anyone to talk to from the state of North Dakota that's gone through it.
Just the people that have done the Be Legendary.
Okay,
side of it.
but that's.
This is a different.
Program altogether, so there really isn't another district right now to give some, like, this was awesome, or this part was so, okay.
Yep.
Can you maybe give the people who's actually running it a second to like, oh wait, this isn't working too, on their end, not just the schools.
Yeah. Start up being like, you know.
Yeah.
So I guess we would either need a motion to move forward with it, or I think we'll just leave it lie, so. That's up to you guys.
Monitor it.
Yeah.
Yeah, I'd like to be more educated, yes, before you, well, I'd be willing to put my name behind it, I guess.
All right. Made to approve, move on. Next item would be this Essential Health Services Agreement. I think we all seen the contract now. We've heard the discussion. I guess if there would be someone willing to make a motion to approve the contract so we could have some discussion.
I'll make a motion to approve.
A second.
I'll second.
All right, let's open the floor for discussion.
This is something that's been looked over by the board and any legal representation that we have, correct?
Yeah,
This will have the final review now.
Okay.
we went through the original one, Mike, and the original was 10-year contract. There was no way out of it.
Mhm.
That's the reason why.
And they didn't have any like way of coverage or anything at
Right.
that time, right? They're just kind of like, we sign this, we'll be wrong, but they didn't really have
I mean,
it.
look from the brief, when I was able to look through it. Fair, I mean, it was a very, and more than fair actually, so.
Does this kind of include the community center?
So when they talk about ongoing collaboration, that's essentially community health and wellness part of it.
I'm assuming that's gonna be its own separate animal, once that kind of starts.
Right, if we have the building built and they become a service provider, and then they're gonna be paying a lease to the wellness center nonprofits, so that part of it will be separate.
Yeah, the 250,000 or the 100,000 or all that other stuff is.
So the 100,000 that's at the school's discretion for marketing and signage. The 250 is also at the board discretion. I mean, if we take it and set it aside for a couple of years and see what happens with the wellness center, we can, otherwise.
Yeah, I was gonna say, can I, Mr. Baszler, Mr. Laxdal, Amber Lockhart and myself met for that 100,000 and like the investment in marketing and signage. We just kind of came up with a couple ideas and like rough estimates. These are not like quoted or anything. Well, just to kind of start the wheel on like what's options for that marketing piece.
Radio copy.
Yep. But they bring somebody out, like from Essentia, and they can say like, well, we did this at this school, or
They send their marketing out. to help.
So like if they put a curtain on the auditorium, when they come together, it would say Essential Health.
Not the rest.
So what do you think?
Yeah, of course, right?
How'd the wrestling wall show up here?
We were just brainstorming.
I'll make some people happy. I don't have any opposition to the contract. I just would like to put it out that I think at the same time, if we approve this, that we should look at our policy. Or just with the question I asked in regards to, it's come up several times where like our trainer recommendation, personal doctor. And there's just that gray area there, and I don't remember what our policy is, or we.
It's in the handbook, Paul.
But I just think we should,
Yeah,
I think we should take a look at it and just. I just would like to see it as clear as we possibly can. And it's been a while since I've looked at it, Terry, so I don't. I just know it's been an issue, so.
That would definitely be something like when they get a person on site, like we gotta sit down, we're gonna have Terry and Race and that individual need to sit down and like, right, this is how it's laid out, so everybody is clear on what expectations are on day.
I'm pretty sure it has, it's not gonna change from what it is now. They have the final say.
Yeah, and I just don't, I just trying to alleviate some.
No, I know,
stuff in
but
the future, so.
that was a whole argument we had last time on the two, Brad, yep. Exactly.
But it was years ago, like from 2010 to 2018, when Grace was in high school, that was still a problem. When that wasn't essentially either. But I can't think of her name, Kathy, usually kept him out way longer. It's just nothing you can, you know,
And it might be there's no,
because I think that was, I don't know what she, not Americare, but whatever they are.
She was Sanford, don't she?
Sanford.
Sanford. Americare, sorry.
She was, you're close. You want to go to St. You would start at St. Luke's. and-
I would have been impressed you called it St. Luke's, but.
Yeah.
It's always been like
Yeah.
hard,
yeah, there's probably no way to.
and I don't know what the right answer is, Brad, but I just remember some families very frustrated too.
Yeah. Other than that, I have no others. Think, yeah. Good job presenting it.
And things you can, you know.
Yeah.
Coming back with something.
Well, I thought it looked pretty open, actually, so it was.
I think they are truly committed to like the educational side. I mean, they want to help with their health sciences.
Yeah, and with that room down there and stuff, now that'd be a good place for them to be able to come out of.
Just general health and in whole, for the whole school,
Right.
for all of us.
I mean, even the discussion of like having them come in and teach the elementary kids to wash their hands, like this is how we properly wash our hand. Right?
Right,
Yeah,
it's not
right.
just because I want to nag.
I mean, I think they're totally open to that kind of discussion.
You know, it's basic CPR. Looking for signs of stroke, you know, that's important.
Have that easy in for job shadow.
Yeah.
I think that's a huge golden egg there that we can really take advantage of for start a lot of careers for a lot of people, so.
Is there any further discussion? Roll call vote, please.
Bierke. Delbert.
Aye.
Johnson.
Aye.
Lovejoy.
Aye.
Birch.
Aye.
Olson.
Aye.
Stefas.
Aye.
Motion carries. Do you want to have numbers for the winter summit?
The early bird registration is due on January 16th, so Friday.
Maybe you better give everyone the dates and times of it again.
Yep, it'll be February 5th and 6th out in Bismarck, at the college.
So, see,
Yep, and Mr. Bachmeyer, the new state superintendent, will be presenting. And they do have like a agenda we can share out, or I think it's linked.
Yeah, mine just went to,
I can't open it.
yeah, mine went to Zoom meetings or something.
Yeah, that's what mine does.
Yeah, but so, yeah.
Let me fix that.
What's that?
is it one registration fee for both days?
Right, yeah, it doesn't matter if you do both or not.
Because the first day is more, appeared to be more, the second day was more negotiations oriented.
Yeah.
Is this something new?
Well, so they
Right.
usually have the negotiation seminar But now they're trying to kind of shift it so that there's more general aspect to it,
They're cutting that stuff that was in October.
Right. other than just being negotiations.
Now, as a new member, would this count towards that? No.
No, that's a new membership.
That's gonna be that special.
It's a
first day.
special meeting that you have. If Mr. Lovejoy stays on and gets reelected, you'd have to go to next October, state law.
Yeah, if you refresh your webpage, the agenda should come up with it. Yeah, I'll probably just send out an email on Wednesday. If anybody's committed, and then work with Stacy to get hotel rooms for those.
I think I would probably tentatively plan to go. I don't know if I would go to the second day. That's why I asked if it was a 1 day, 2 day thing.
Yes.
I would tend to done 4 o'clock. Yeah, if you just go.
Yeah.
Go early and come back almost.
Yeah, there's no way I could go.
I mean, last year it was still pretty negotiations heavy last year. But we were in the negotiations. Well, Paige will send out an email. Get feedback on whether or not you want to attend later in the week. Other than that, we would just wait. If I missed anything. I don't think so. I think we're down to approving the general fund bills for a month.
Yep.
We have a motion to approve the general fund bills for month.
I so move. I'll second.
Any discussion?
What's the 95%?
They do special education curriculum. We have a new educator this year. And that's what they requested.
Okay,
It sounds weird though.
yeah.
Mrs. S might know more about 95%. I think it was elementary special ed.
Yeah, so we have super kids and they don't have like an intervention or a tier 3 program. So 95% is one of those programs that we had approved last spring when we were going through our MTSS process, reviewing and updating things. And so that was one that chose to use as an additional support or a complete pull-out intervention program for someone that was 2 years in intervention. We don't have many, but we needed something that was effective for those learners.
No, that's just a one-time deal.
All right, any further discussion? Hearing none, roll call vote, please.
Pierkey,
Aye.
Silbert,
Aye.
Johnson,
Aye.
Lovejoy, Merch,
Aye.
Olson,
Aye.
Stefas.
Aye.
All right, then we'll need a meeting to, or motion to adjourn.
Also move.
Second?
Well, second. I'm gonna get into a conflict.
Thanks, everybody.
Now we can move to casino.
Now we go.
Who's driving? I was looking at the guy.